Okay, let's start about the I just continue my previous lecture. So in the Parkinson disease there are some stages in the Parkinson disease. Stages like that, maybe if the patient present to you with the stage 1 or stage 2 or stage 3 or stage 4 or stage 5. So these are the stages how the Parkinson disease finally disable the patient. Initially in the resting tremor, I will start from here. Tremor Tremor develop in the hands. So tremor is the early manifestation of Parkinson disease. That tremors often improve or disappear with purposeful function. When you are doing some action like you are taking the glass, so maybe this tremor will disappear. But if you are not taking anything, that tremor will develop. So this is we call what resting tremors. Then there is a bradykinesia, the difficulty in performing simple action like just to close your shirt or like to wear any dress. So this is a bradykinesia, mean is a decreased movement. So this is the thing that how that Parkinson disease, how the symptoms develop slowly, initial tremors, then purposeful movement, then bradykinesia. Now come toward that gait disorder. In the initial stage, as you can see in the initial stage, that in which there is a in the one hand tremor develop, not both hands. In the one hand tremor develop and mild gait problem, but not bilateral hand tremors, unilateral and mild tremor. So this is a stage 1. And then there is a stage 2. In stage 2, see in that posture there is no truncal ataxia. But in that posture, see little bit flex posture and both hands come to each other. In that one hand just here. In that both hands close to each other and the gait, see in that patient in that stage 1 gait is different. In that stage gait is different. So this is a stage 2. And then there is a stage 3. See in the stage 3 bilateral resting tremors or more bilateral hand tremors along with gait problem and along with flex posture. So this is a pronounced gait disturbance. In stage 1 there is no bilateral hand tremor, but in that stage 3 there is a bilateral gait tremor. And then is a stage 4. In the stage 4 there is a significant disability and limitation of the activity. That patient unable to walk, so that staff nurse just help the patient to walk. So in that first stage patient can able to walk without any support. In that too patient walk with little support. In that patient also needs support, but in that case patient need more support. Why? Because patient become disabled, unable to perform the activities. In stage 5 there is complete disability. See this is a flex posture. See this just like a kyphosis. This is a flex posture. In here there is not prominent flex posture, but here flex posture, resting tremors, gait problem, and patient is unable to talk well. So this is the stage 5, that complete disability of the patient. So see how the symptoms develop one by one. It doesn't mean if someone develop Parkinson disease immediately they develop disability. No, it's wrong. First that symptom develop, slowly symptoms develop. If you not treat on time, it can cause early disability. For example, if someone develop Parkinson disease and you are giving the medicine, maybe patient stay on stage 1. But if you are giving if patient quit the medicine, maybe patient develops so much disability they come on finally on the wheelchair. So this is a very important thing about the how the Parkinson disease symptoms develop. Now I will talk about the physical abnormalities in the Parkinson disease. In physical abnormalities, first of all there is an expressionless face, abnormal speech, and flex posture, which we already talked in the last PPT, and slow to start the walk, and reduced arm swing and resting tremors, and rigidity of the upper limb and lower limb, and bradykinesia. So this is a very important thing in the Parkinson disease patient, how they present, how in physical examination how you will see. And see this is also a Parkinson disease symptom, that how you will classify the symptoms. And this is see rigidity, posture instability, resting tremors, bradykinesia, and then there is a abnormal gait. So in my next video I will continue this lecture. Okay, thank you so much.